Hi, my name is Wong Xiaoxian. I would like to present my assignment with the title of Neurodegenerative Disorder, Molecular Pathways to Clinical Implications. In this topic, I will briefly introduce neurodegenerative disorder. The two major neurodegenerative disorders, which are the Alzheimer's disease and Parkinson's disease, in terms of their symptoms, pathogenesis, diagnosis, treatments, and applications of artificial intelligence in neurodegenerative disorder. Neurodegenerative disorder refer to the chronic and progressive impairments induced in the nervous systems, including the neurons, glia cells, and slowly extend to the neural network in the brain and spinal cord. WHO estimates that almost 50 million people are impacted by neurodegenerative disease, and these statistics are assumed to be inclined up to 152 million by the year of 2060. Neurodegenerative disorder is discussed as dementia-type disease, demyelinating disease, Parkinson-type disease, prion disease, and motor neuron disease. For the case of dementia-type disease, such as Alzheimer's disease and Lewy body dementia, on the other hand, for conditions of motor neuron disease, the clinical presentation of the patients will mainly focus on the physical movement, such as amyotrophic lateral sclerosis and progressive supranuclear palsy. First, let's talk about Alzheimer's disease. About 60 to 80% of all dementia patients are diagnosed as Alzheimer's disease. Alzheimer's disease patients will have the clinical symptoms of cognitive decline, memory loss, disorientation, failing to reasoning, getting confusion, and physical movements failure like dysphagia, speaking, and walking. The pathogenesis of Alzheimer's disease is related to the amyloidogenesis process. The beta secretase cleaves at the amyloid precursor protein, known as APP, at the extracellular site, leads to the release of soluble APP beta fragments and a membrane-bound C-terminal fragment, is known as the C99. After that, the gamma secretase cleaves at the C99 to produce amyloid beta peptides, which are the amyloid beta 40 and amyloid beta 42. The amyloid beta 42 is chemically insoluble and has a greater tendency to aggregate. The amyloid beta 42 cluster in the form of oligomers will be formed first, then they become chains of clusters in the form of beta sheets of fibrils, and lastly creating amyloid plaques. The accumulations of these amyloid beta peptides build up plaques and they are neurotoxic, disrupt the neuronal communications, trigger neuroinflammations, oxidative stress, and cell death. The clumps of amyloid beta plaques generate harmful free radicals as well. Amyloidogenic pathways and amyloid beta aggregations highly rely on the stimulation of the metal ions, and this process will produce hydrogen peroxides as a result of reduction of metal ions. For example, the combinations of copper-2 ion will further deepen the toxicity by releasing reactive oxygen species. Now, tau protein is also identified in Alzheimer's disease. It is a type of protein that is microtubule linked and normally exists in the cytoplasm of the axon. The tau proteins are usually used for microtubule stabilizations. However, due to the imbalance of enzymes which are responsible in the process of phosphorylations and dephosphorylations, will lead to the situation of abnormal hyperphosphorylations in tau protein. Subsequently detach from the microtubules and aggregate to build neurofibrillary tangles. At present, MRI and CT scans are commonly used to look for any shrinkage in the brain. Besides, PET scanning radioactive tracers is to look for the brain regions where the metabolism is not regulated properly, and to check for any amyloid plaques or neurofibrillary tangles in the brain. At the current stage, the biomarkers are still under research for the potential use as diagnostic lab tests. For example, Cerebrospinal fluid is used to test the levels of total tau proteins and phosphorylated tau proteins and finding the presence of abnormal accumulations of amyloid beta. While the apolipoprotein E gene is used for genetic testing. Apolipoprotein E is a variant found to be associated with the critical type of Alzheimer's disease, as this genetic variant boosts the risk of progression of Alzheimer's disease. Blood amyloid beta 42 to 40 ratio reflects on amyloid plaque burden in the brain and to be applied in the prevention trials and to assess whether individuals will develop Alzheimer's disease, dementia, and resulting amyloid PET scan positives. The cholinesterase inhibitors have been prescribed to the Alzheimer's disease patients to improve transport of signals between cells. The benzalgalantamine and rivastigmine transdermal patches are to improve the behavioral symptoms like agitations. And memantine impacts on the brain cells communications and decelerate the worsening of cognitive decline for the moderate stage to severe stage of Alzheimer's disease. Now let's talk about Parkinson's disease. Parkinson's disease affects those after 60 years old, and in a range of 5 to 10% of the Parkinson's disease patients experience an early stage of Parkinson's disease in the age of 50. In current studies, the researchers conclude the exposure to pesticides is considered as an environmental factor that increase the risk of Parkinson's disease. Most of the Parkinson's disease cases show remarkable death of nerve cells that are taking part in producing dopamine, thereby leading to the damage and impaired functions of basal ganglia in the brain. As a result of dopamine deficiency, the patients will develop tremors, difficulty in coordination, frequent drooling, lesser eye blinking, dysphagia, hypophonia, loss of sense of smell, and diminished cognitive functions. As well, the neuron cells that play a role in producing norepinephrine will be affected as well. The failure to produce norepinephrine, the non-movement symptoms will be developed. For example, unusual associations, abnormal blood pressure, heart rate, and reduced peristalsis to push the food through the digestive tract. The pathogenesis found in the Parkinson's disease is the aggregated alpha-synuclein to form Lewy bodies and Lewy nucleus in both motor and non-motor areas in the brain. Thereby, the impairments included in mitochondria, lysosome, vesicle transport, synaptic transport, and neural inflammations. At the same time, oxidative stress is induced and further deepens the damage on neuron cells. There are studies concluding that demethylated SNCA genes do not have an inhibition effect in expression of alpha-synuclein proteins, resulting in high production of alpha-synuclein proteins. The biomarkers of Parkinson's disease are measuring the difference of alpha-synuclein proteins expressed in CSF and plasma between the Parkinson's disease patients and healthy individuals. And dopamine transporter single photon emission computed tomography scan construct a 3D image of brain combined with a radioactive tracers to differentiate between dementia with Lewy bodies and Parkinson's disease. Alpha-synuclein seed amplification assays will be able to detect the presence of misfold alpha-synuclein aggregates. It applies the protein misfolding secret amplifications or real-time clocking induced to activate the process of misfolding of alpha-synuclein seeds that was collected in the body fluids. After that, it will detect the fluorescent signals generated by the aggregate fibrils. At present, the traditional treatments are the anti-alpha-synuclein monoclonal antibodies, inhibitors of misfolding of alpha-synuclein, and immunosuppressive agents. Moreover, the omega is a dopamine agonist, which is an apomorphine hydrochloride that regulates the unwanted motor fluctuations. The advantage of this treatment is that it is an under the skin infusion and bypass the digestive system. Interestingly, using San Francisco implement an adaptive deep brain stimulation algorithm to adjust the movement fluctuations. This algorithm works like a brain pacemaker that detects the electrical pulses in the cerebral cortex and decoding them to resist the stiffness and involuntary motor response before they arise. However, this device is still under research stage. AI has started to be applied in medical industry. Firstly, with the combinations of machine learning and deep learning algorithms, AI is able to generate scanning images in more detailed feature extractions, segmentation, as well as classification of structural changes in the brain that will provide more supportive points for physicians to make accurate diagnosis. Furthermore, deep learning algorithm has shown its competency and accuracy in identifying the significant metabolite level difference between the neurodegenerative disorder patients and healthy individuals. Apart from that, the researchers are also investigating its potential use in grading the disease progression that provides clues for the physicians to prescribe more appropriate personalized treatments and therapies. At the same time, there are studies exploring the use of AI to provide predictions of the risk to develop neurodegenerative disorder based on the biomarkers and risk factors exposed to the individuals. This is crucial for the physician to design the suitable interventions to decelerate the onset of neurodegenerative disorder. However, there is so much space to be attained before confirming the applications of AI in diagnosis of neurodegenerative disorder. The prevalence of neurodegenerative cases linked out with the geography, race, and the gender factors included in those studies were still considered as insufficient. Inconsistent data or sample collections, processing, and analysis cause AI is yet to be considered as a promising quality tool. Not only that, there is risk of breaching ethical issues when personal information and genetic information were employed into the big data learning process. In conclusion, neurodegenerative disorder with progressive and incurable symptoms pose many serious challenges to global health due to their complex and unknown pathogenesis. The continued comprehensive research is required to sufficiently in revealing the precise pathogenic pathways, identifying the more promising diagnostic tools, developing targeted treatments, as well as attending and prevention of neurodegenerative disorder onset and progressions. Solving these challenges is essential to improve patients' health conditions and effectively reduce the societal and economic burden. This is a reference I use. And this is the end of my presentation. Thank you.